Welcome back again. Only this time it's time for Wellness Central inside of Breakfast Extra, where we focus on the health issues shaping everyday life across Nigeria. Now, this morning, we're looking at a trend many of us are guilty of, including myself. The fast food rush. From Lagos to Abuja, Port Harcourt to Kano, the quick service restaurant culture is booming. Nigerians are eating more fried foods, sugar drinks, oversized portions, and highly processed snacks than ever before. This quiet shift in our diet is fueling a rise in obesity, hypertension, diabetes, and heart disease, especially among young adults.
So what is driving this growing reliance on quick meals, and what can be done to reduce the silent health risk? Joining us are people who's done extensive advocacy on healthy food system. Abayomi Sarumi, who's Associate Director of CAPPA. And of course, we have Temitayo Ajibade, who's also a manager at a restaurant. Gentlemen, good morning. Happy Sunday. Thank you for joining us.
Thank you very much. Abayomi, let's start with you. Give us a big picture here. What is this fast food problem in Nigeria? How drastically has our eating culture actually shifted from, the past 10 years up until now? Abayomi.
Good morning. Thank you so much for the opportunity to join you this morning. The fast food problem is a very big one, like you mentioned in your introduction, and it just goes beyond the few fast food that we categorize as fast food. I think the general problem is ultra processed food. And these are food that have gone through lots of processing, minimally processed, that have caused a change in the food structure, especially in the content of high sugar, high salt, and high fat, which are all unhealthy. But what we have seen in the last 10 years is that our dietary pattern has changed, and it is due to what people have agreed to be urbanization, westernization of our diet, and the false idea of convenience that when you eat this food, you are saving time, you are getting your food on the go, and you are getting filled up. Whereas the truth is, this food do not have any nutritional value or minimum nutritional value, depending on the level of processing on the spectrum of from unprocessed to ultra processed. And this has contributed a lot in the last 10 years, like you mentioned, to the issues that we see around non-communicable diseases, specifically around the predisposing factors, the obesity, diabetes. And if you look at the data vis-a-vis consumption of food in the last 10 years and diet-related diseases, you would see clear-cut connections that shows that the more we go into this food, the bigger the problem and prevalence of non-communicable disease becomes in our society. So it is not just that we are eating, we are losing our cultural food, because again, the whole idea of food and food justice is that we eat what is healthy, nutritious, what is accessible, and what supports our sovereignty. It should be what is culturally appropriate. So we now eat food that are no longer culturally appropriate because we've reappropriated what these things should be, what our meals should look like. We change them it to be like a group of people's own. That's why we say westernization of diet. But generally, it has coincided with the increase in non-communicable diseases, and this is a big worry. It means that we are not just changing diets, we are also changing the trends of disease that the country is open to.
We know that, recently everything is basically on socials, on the internet. And of course, there's heavy marketing on sugary drinks, combination and, fried foods and all that, very easy and sharp for young people. Would you say that, the pressure in the marketing and advertising is what is influencing this healthy diet? Trisha, are you going to blame it on the influence?
Yes. Yes, we are absolutely going to blame it on the influence of marketing, because it is unfair to, put this blame solely on individuals. If you ask me why, I will give you quite a number of examples. When people who make this food, note again that there is something called the information asymmetry. People who produce this food largely are aware that their food have no nutritional value. Yet they market them as convenience, as food of champions, as food people must eat so they attain a certain stage. Now, when you bombard the mentality of people with this kind of advertisement, you do not now begin to put blame on them. So it is clear that marketing of ultra processed foods, fast food, have a large impact on how people begin to consume. As early as May this year, my organization, CAPPA, launched a report that looked at the way products are marketed offline, just offline alone, looking at signposts, the messaging, the subtle messages, and we used 7 states in the country. And what we saw, this publication is available publicly. It is online. Everybody can find it. It's called Junk on Our Plates. And it itemized how foods are marketed in Nigeria, even to the point of appropriating cultural importance into how these foods are marketed. You would see a lot of big festivals. You see Judioba, you see a lot of them where products or producers of ultra processed food come into that space and attach it to the cultural event. So it now begins to look like when you take a particular food, it mean they are trying to re-engineer the way food culturally appropriate means. They are now also marketing it in a way to say that if you eat this particular food, it helps you to achieve ABC. And this is simply misleading, not even speaking to the health concerns. Like I mentioned, that there's the information asymmetry. People who produce are aware of the dangers or the likely dangers of the product. But this is not included in marketing. What is included is, oh, this is the breakfast that will help you get your day to the point where it needs to get to, or this is what will turn you into a pilot or the best footballer. I mean, it erodes the true messaging of hard work, of consistency, and all of that. Then it also neglects the health implications of this food. And this is why it is very important that policies and government regulations come into place to ensure that these food are not marketed dangerously, not just to young people, because again, there are people who, there are category of children that cannot make purchases at a particular time. So their parents are also targeted. So this kind of marketing must be reviewed with strong regulations that are mandatory, not voluntary regulations, mandatory regulations that can ensure that kids are protected, vulnerable groups are protected, and health implications of ultra processed foods are clearly noted. In the last 10 years alone, we've seen up to 30% change in dietary in our dietary pattern. And this would only continue to get worse if these policies are not put in place at the right time.
Because he is a manager at a restaurant, and I want him to tell us exactly how this applies from his side of things. However, I do not remember the last time an advertisement actually made me go buy a combo meal at a fast food store. I do purchase and I do patronize fast food a lot because it is convenient. And for me, it's the convenience that outweighs the marketing. And I'm wondering, how can we make Nigerian meals, cultural meals like you call them, more accessible? Because it's not easy to package pounded yam and stew, or what soups do we use now?
Eforiro.
It's the packaging that makes cultural foods inconvenient. Fast foods are faster for packaging, faster for carrying about. So what do we need to do to tip the scales here? We're talking to you, Abayomi.
Oh, thank you very much.
Yeah.
I think you mentioned that you do not remember the last time an advert made you buy food.
Yeah. Mm-hmm.
But as a journalist, you are aware of the power of subtle messaging. You wanted to buy for convenience, but again, when you got to the point of purchase, you began to look at your choices, and you felt that, okay, let me buy maybe a bucket that's this and that. Your first decision might not be based on the advert, but when you are always
bombarded by,
permit me to use the word attack, Yes, bombarded. That's the best word. Bombarded by these adverts. It builds up uh, unconsciously or subconsciously, and you get to that point where your decisions are affected by that.
Then in
So
that
what we
case,
need to
why don't we
understand
why don't we focus on trying to make cultural foods look as aesthetically pleasing or as convenient as we have fast food being advertised as well?
they are as pleasing as it should be. When we come to the point where we start to package them, we begin to add additives, preservatives, and these are the issues. Your pounded yam, I think it is best served hot with that beautiful vegetable soup. You would see that I'm smiling because the image of pounded yam brings a lot of joy.
Thank
So
you.
what I am saying is, when we begin to package them, we now begin to process. We now begin to put preservatives, and these are where the issues are. These additives, a couple of them have been identified to be carcinogenic. So the issues with ultra processed food or fast food, deep fries, and all of that is not usually about that the starting point. It is what comes at the end, because when you eat them, the danger is it builds up in the body. We've mentioned obesity, we've mentioned diabetes, and all of these lead. They are non-communicable. They are predisposing factors, and then non-communicable diseases that take forever to manage. They are not treated. They are managed. They are lifelong diseases. So when we begin to look at these issues, we need to look them uh, totally along the spectrum of economics, socials, and health-wise.
Okay.
But the biggest impact is in the health that then affect our economics, that then affect our social fabrics. Because if you take an example of, let's say, a family of three with one down with NCD, the other adult who is supposed to work in that family begins to do unpaid care to take care of that person that is down with NCD. Maybe the third person is a child, the education is affected, a whole lot of interconnections. But what is more important in foods that are culturally appropriate or healthy food is that they have been minimally processed. So you still cook, you still pound your yam, you still cook your vegetables, you still use seasonings, even seasonings, though a lot of them are ultra processed, but you still use many of them. So there are limits at that point that you can now go to. In your minimally processed foods, maybe you are using seasonings. Again, our advocacy is that we should recourse to naturally occurring. We have a lot of them. You have your locust beans. You have the spices
Abayomi,
that
just
you
a
use that
second,
have been
Abayomi.
packaged are also available.
Just a
Yes.
second about me. I want to introduce Temitayo Ajibade. He is a manager at Fight Restaurants, if I'm not mistaken. I would also like to get his take on the conversation here. Temitayo, you're welcome. Thank you very much for joining us. Temitayo, please, first off, if you will, tell us exactly what kind of foods you are attuned to serving at your establishment. Are we talking fast foods here, or are we talking cultural foods like your eforiro, your amala, and all of this? What kind of foods do you serve? Temitayo. Temitayo, I'm hoping you can hear us. I think we have a problem with the connection with Temitayo, unfortunately. Queen, I'll let you go with a question for Abayomi, please.
So Abayomi, as a chef, we know that you have a pastry chef, and then you have the hot kitchen, you have the cold kitchen, and somebody who's eating a burger will tell you, oh, it's just bread, a beef patty, lettuce, tomato, and a mayo. So how are you going to convince a chef who's a pastry chef to be able to explain to their client that eat cake, but don't eat too much cake? Because basically, their chefs are the one who's making all this food. So how is CAPPA able to incorporate all this and explain to people that, okay, fast food is not good, but then, there are chefs who are also making this food. How are we going to fix that?
Thank you very much. We are trying our best to ensure that the message is not lost on people. We are not attacking businesses. What we are asking for is that people come to a point of understanding, that they begin to see that diet-related diseases are common amongst us. So when people see a diabetic person, or let's just use hypertension, sometimes people cannot link it with how much salt they've eaten. The funniest part is Nigerians are aware that if you eat too much salt, it is dangerous for your health, but they do not know to what extent. So they cannot. You would hardly be able to tell a Nigerian that taking a bottle of soda or SSB a day predisposes you about 25 to 30% chance of having diabetes. Just a bottle gives up to that 30% chance of having diabetes type 2. And that this could lead to about 15 types of cancers. They cannot not make that connection. So what we need to do is to look out for the nutrients of concerns. Nutrients of concerns include sugar, salt, and fat. And this is why we are asking for policies. There's a data, a Nigerian data, from a study conducted by the cardiovascular department of University of Abuja, and it listed out sources of high salt in Nigerian food consumption. And that bread that we've mentioned is one of it. Remember that bread is not even salted to taste. You can't feel salt in your bread, but it is highly salted to get to the point where it is. And there are a lot of food like that. So what we need to begin to do is, for us, we believe that food is the art of making food is artistic. You need to be able to find the right combinations. So when our chefs begin to understand that there are health implications to what we are eating. I mean, 30 years ago, this food could, in fact, maybe not 30 years or way before that, people could eat these things without concerns. But there are scientific evidence across different parts of the world showing that the way we eat is impacting our health, our body.
Okay, then Abayomi.
The overall.
All right, then Abayomi. I think we have Temitayo back again. Temitayo Ajibade, are you here? Can we first of all make sure that we have your audio? Temitayo, are you with us?
Yes, good morning.
Grant, Temitayo.
I had a little issue
Fantastic.
with my connection.
Finally, we have you. We're excited that you're here. Temitayo, where do you stand on this fast food versus cultural meals? Where do you stand on it?
Fast food currently is doing a lot of damage that we Nigerians are not necessarily paying attention to at the moment. But because of the profit and the way we want fast food now, because of the time, many Nigerians are not really paying more attention to their own health. They just want to get food fast. So it has really plummeted the Nigerian cultural way of eating good food. So it has affected us in so many ways that our personal hygiene, fast food causes a lot of risk, weight gain, obesity, heart diseases, and all of that thing. But Nigerians particularly do not really pay attention to these things as long as they can get food fast. So if you want to eat good food, it will take longer time. So is that time factor now that's not really in consideration for us? People want to go about their day-to-day life, just want to get something to just eat and just put themselves up. So that's why it's like that.
Right. So, Temitayo, let's talk about the part of business. And I know how long hours chefs have to stand to prepare a steak or an Alfredo pasta, proper meal. And you know that Nigeria is already challenged with, infrastructure, roads, traffic and everything. And they probably have 1 hour for lunch break. I don't think they have the time to wait for, people to pound the yam and make the foriro fresh for them. So how can you say that the chefs making the actual food, the proper food, how can they compress time and also the prices? Because I know the pounded yam is not cheap. So the Nigerians can also weigh and say, oh, instead of me eating, fast food and freezy drinks, I can quickly get something sharper. How can we do that?
The thing is, I run a restaurant here. So what we do is we run a la carte. So all my meals are freshly made. So early in the morning, I'll send my menu to my customers. So by so time, what will you be eating? So we can make it ahead of time. Okay. But if you walk into the restaurant, you just get fast food. But if you want to eat a good food, you still have to. It will take time. Yeah. So we've prepped some of the condiments. So in about 15 to 20 minutes, you should be getting your soup ready, your food ready, good food.
Right. Okay.
I'm wondering exactly what people go for, or what you've noted that people, customers go for. Do they readily just simply go for fast food, or do they go for proper meals, Temitayo?
First off, it depends on the timing. If it's in the morning, people want to take something light. They don't want to waste time. They just want to walk into a restaurant, get something to eat. But in the evenings, some people are very careful about what they eat. So they take time to be like, okay, I want to eat this by this time. So can you make it for me? Because they have the luxury of time to sit and wait for their food to get ready. But during the daytime, morning and afternoon, people prefer to go for fast food.
Okay, so now the question now is, if they prefer to go for fast food, how's that affecting business for you, who's used to preparing more cultural meals, proper meals? Does that make the patronage less?
To some extent, yes, because me, I'm more particular about the health of my own customers. So it will affect, because I don't make most of those meals available by that time. So then I work based on order, because it's a la carte meals.
Very
So now the
interesting.
fast food part, I just make few foods, about 10 to 12. The normal one people eat regularly, the rice, the spaghetti, the burgers, the meat pie, and all of that. So it will affect the business because of the profit, actually. I won't lie, there's more profit when you go into fast food, but it's not healthy for the customers. I tell my customers this from time to time. So it's less for you to decide if you would like to hold on for a bit. Let's just make something nice for you, or just like to pick something up and go. And instead of the soft drink and soda, I just implemented fresh juice, freshly squeezed juice. So instead of that, you can just have that. I'll just tell you, okay, this is what this is. You don't need to take this and all of that.
So what you're saying inadvertently is that you can't have these foods in store. You can't just make them and keep them and say people are going to come and buy. Much like when you have fast foods, you can have it, in reserve, and you're sure that at the end of the day, it's going to be exhausted. But for cultural foods, you can't do this because not that many patronage comes through. Now, let me come back to Abayomi. Abayomi, now we can see the very interesting nature of fast food versus cultural meals. And I'm wondering if you, and most of your messaging has been to the individuals, warning them about the health implications. Now, if this fails, and it seems like it's a very slow process, what other fallbacks do you or your organization have? For instance, is there consideration for maybe attacking this with policies? In other climes, for instance, in the United States, obesity is a problem. What they've done now is they've asked fast food or soda makers to reduce sugars or use alternatives to sugars. What are we looking at here in Nigeria to be able to curb this menace we have with fast foods?
Thank you very much. And I really understand the points made by Mr. Ajibade. I just want to say that, like we've mentioned, that in the last 10 years, we've seen a shift in food, in dietary pattern. What we need to work towards is to make that shift back to healthy consumption. And it starts with awareness. And many thanks to you and your platform for giving us this opportunity to have this conversation. People need to begin to look into what they eat. So they need to understand. We have social media channels, we have articles, a lot of things speaking to diet-related diseases and why we need to shift back to foods that are healthy. And on the side of policy, like that you mentioned, the US and its obesity problem, Nigeria currently has a tax on SSB, sugar sweetened beverages tax. I'm not saying sugar tax, so people do not misunderstand it to be taxes on sugar. There's no tax on sugar. It is beverages that are sweetened with sugar that is being taxed. And one thing, why we commend the government for putting this tax in place, one thing is that tax is negligible and cannot achieve the desired results that the government wants. So it means that we need to, when we make policies, we must make them in a way that are effective. So an example is that policy should come in place, SSB tax increased and earmarked for health. So when you put taxes in such products, you don't just collect them and keep in government coffers. You put them back in health to provide health care for people who are already down with NCD or other form of health issues. You can put a part of that tax into nutrition awareness, an awareness led by the Federal Ministry of Health and Social Welfare. You can put a bit of that in agricultural production to allow people have access. I mean, he mentioned freshly squeezed juice. A Nigerian would usually, from evidence, would buy a bottle of SSB, a bottle of soda, instead of a freshly pressed juice because it is more expensive. But when we put taxes on those unhealthy products, we can tilt the balance and now begin to make more healthy products friendlier, cost effective, I mean, pocket friendlier, and people can begin to buy them. There are a lot of policies that need to come into place, not just one. Advertisement must be reduced, sensitization must be increased, and it has to be government-led sensitization. This is why we are asking for government-led sensitization because they are in charge of all of this. So it comes from a point of authority. They are aware that these issues are going on. Kudos to the Federal Ministry of Health and Social Welfare. We've had a lot of engagements with them, and we know that they are doing as much as possible. But it needs to be scaled. People need to hear this on a daily basis. The way we hear about the advertisement of this product, we hear about the health implications and begin to make those shifts. Other policies that would help Nigerians. And when you pick up a product, the label is not legible. You can't read it enough, let alone take time to find out the level of sugar, the level of salt. So there must be the policy, a mandatory policy on front of pack warning labels that can warn consumers immediately to say this product has excess sugar or excess salt or it is high in trans fat. And at that point, people can begin to make healthier choices. They can now decide, okay, I have seen that this product is unhealthy for me, but I still want it. That's your brain. Remember that there is a tax on some of it. Government is keeping a part of them to take care of those people already. And again, the impact, I mean, policies must also look at the production environment. What are we doing to support restaurants like that of Ajibade? What are we putting
Just a second,
in place?
Abayomi.
Are we giving it subsidies?
Abayomi,
Yes.
apologies, we're running out of allotted time, but Queen has one last question for Temidayo before we leave. Queen, please go ahead.
So Temidayo, my question would just be simple. For an average Nigerian now who's busy and stressed, what would be your advice to them as to why, when they get to the point to choose between fast food and actual food, what should they consider?
We have is we don't really look into what we eat, according to what Mr. Abayomi said. So what I suggest for my customers is that once a day, make sure you're eating one healthy meal a day. You need to cut all sodas, drink more water, make sure you're eating one healthy meal. I understand that in the morning you might want to just grab something that is okay, maybe fast and just eat. But once in a day, eat a good meal because it will help you a lot and prevent the risk of fast food.
Right. Well, gentlemen, thank you so much, because I know this is a conversation that can go on and on and on. And again, I think it's a habit, and let's hope that people get to listen to this and, change their lifestyle and choose to, eat healthy. We appreciate both of you for joining, Abayomi and Temidayo. Thank you so much for joining this morning.
Okay.
Thank you, gentlemen.
Thank you.